Madi. Today I'm going to be demonstrating the sterilization portion of the video. I'm going to go ahead by hand hygiene. My trash bag is next to the patient's hip this time as well as the patient. I'm going to go ahead and start by opening up the kit. I'm going to place this off to the side due to possible remediation again. I'm going to go ahead and just drop this. Alright, so now I'm going to go ahead and drape you, Miss Tupo. I'm going to place a drape underneath your buttocks. If you can just go ahead and lift up your hips for me a little by using your butt. Perfect. Now I'm going to go ahead and place another drape over your perineal area, making sure that my hands stay above my waist the entire time. Perfect. All right, Miss Tupo. So I'm gonna go ahead and open up my supplies really quickly, and then I will be able to start working on everything for you, okay? I'm gonna squeeze some lube out. I'm gonna throw that away. Gonna go ahead and open up the calf just so that I can have it laid in the lube after I clean. Okay, I'm gonna go ahead and open up the alcohol swabs. Okay, also gonna be throwing that away. I will be taking them out of the package. Okay, now I'm gonna go ahead and this on here. Okay. All right, so I'm gonna go ahead and clean you up really quickly. Yes, I have to clean you again, Miss Tupo. And then I'm gonna go ahead and insert your Foley. I am going to touch your perineal area and it might be a little cold, okay? I am going to be using my non-dominant hand, which will now be my non-sterile hand. I'm gonna go ahead and clean furthest away from me first. Doop, doop, doop. Throw that away. Closest to me, doop, doop, doop. That away. And then as well as in the middle, doop, doop, doop. Throw that away. Alrighty, Miss Tupo. So this part might be a little uncomfortable, but you let me know if it's causing you any excruciating pain. I'm gonna be going ahead and having you do some breathing exercises. Inhale and exhale. On the exhale, I will insert your Foley. So I'm gonna grab it 2 to 3 inches. I'm gonna go ahead and make sure. Okay, inhale and then exhale for me. Okay. Perfect. I'm gonna wait until I see some urine. I see some urine flashback. Perfect. So now what I'm gonna do is enter 2 to 3 more inches. All right. So now I'm gonna go ahead and take my hand off of your perineal area, and I'm gonna use that to hold secure as I put in them, as I inflate your balloon. Okay, Ms. Tupo, you're doing okay? Okay, thank you. You're doing a wonderful job. Good job. So now that I'm holding this by 2 fingers, I'm gonna go ahead and inflate your balloon. Let me know if you start to feel very excruciating pain, but you're doing a wonderful job, Ms. Tupo. Good job, good job. Okay, I'm gonna tug to see if I have resistance. I have met resistance. I'm gonna go ahead and take this off, and I'm going to dump it. Alrighty, Ms. Tupo, how are you feeling? Good? Okay, so now I'm gonna go ahead and clean up your perineal area, get all the lube and everything off of there. If you can just give me 1 second, I am gonna go ahead and take off your drape. Perfect, thank you. And then I'm gonna rip this. And I'm gonna clean your perineal area, okay? Okay, perfect. I'm gonna go ahead and clean up my supplies really quickly. Perfect. And I'm also gonna secure the port at your thigh, okay? All right, so it's secured. I'm gonna go ahead and put the bag over your bed and not the railing. You let me know, okay, it's on the side of the bed. You let me know if you start to feel like you have to go to the bathroom, you have any discomfort or very uncomfortable pain. Let us know by pressing your call light and we'll come in right away, okay? Okay, perfect. If the port starts to get very uncomfortable on your thigh, then just let us know. We'll come in and try to secure it a different way. It is gonna be on your inner thigh. That's the only place it can go. But we can try to make it as comfortable for you as possible. Okay, the bag is gonna go with you everywhere. I'm gonna go ahead and take off my gloves, Ms. Tupo, and I'm gonna hand hygiene really quickly. Do you wanna be put in a more comfortable position, or are you okay where you are? You're okay where you are? Okay, perfect. So now I'm gonna go ahead and document my findings, let the provider know if there was any issues, and good to go.